sorry, the name of the presentation is a bit wrong. I should have called it Missions of FAO and Biodiversity. But we're going to go through surveillance response and some of the activities of FAO in terms of project management. So I'm going to present to you first what is FAO. Second, a bit my experience in FAO in terms of first emergency management, response and preventions to infectious disease, and then a more long-term work of FAO, which is also implementing capacity building programs in countries. So I will try to show you the missions of FAO, the Food Agriculture Organization of the United Nations, and then I will get into something I don't know much, which is biodiversity and impact in infectious disease. Okay? You can stop me anytime. This is the galaxy of the United Nations. Okay? This is, I don't know who wrote that, who was able to do it, because you have lots of organizations within the UN, and that's where FAO is. With WHO under, we're just the few of the technical organization of the United Nations. FAO is basically dealing with agriculture and food. The aim was created in 1945, based in Rome, in Italy, with around 193 member countries all over the world, and the main mission is to free the world from hunger. What does FAO? FAO share technical expertise to countries. FAO has technical staff, veterinarians, biologists, virologists, economists, and FAO also provide reports and communication materials to countries, developing countries. So it's basically a service, a technical service related to food and agriculture to the member countries of FAO. It's also an interesting organization because you have countries that can have neutral meetings, and I will show you the example of Israel and Palestine at the end of this presentation, where FAO also have an impact in the peace process all over the globe. So it's also a place where you can have countries having political issues, being able to discuss about technical issues to control disease or to increase the production of food. And we provide technical knowledge on the field. Really quickly, you heard about it. That's something that has been around for some time, the One Health approach, where you have an holistic integration of animal health and human health in terms of controlling and preventing disease worldwide. So what are the impact of animal disease for the veterinarians in the room? Of course, you have human health. You have food security. Of course, when you have a country that is hit by a foot and mouth disease or avian influenza, you have depletion of protein sources for the population. So you have to make sure that the animals are kept safe from disease, infectious disease. And you can also have an economic impact of those diseases in terms of trade, where you have blockage of trade partners, and also control measures that can be really expensive in terms of production. When you apply vaccination for many years in countries, you have all the things around vaccination, controlling awareness of farmers that can have some cost to just control a disease. We work a lot about transboundary animal disease. Being an international organization, we look into preventing the spread of animal disease between countries. In terms of securing the economy, the trade, the food safety and security of the countries to avoid any major impact on those countries, you have to react fast to be able to control those diseases, and I will show you after an example of internationally based response unit to animal crisis. And those diseases, if you leave them way too long, they become difficult to control and eradicate. So basically, you lose the war. It's a war situation. And those diseases usually need international cooperation. Some countries get overwhelmed by the disease, don't have the human resources, the economy, the funding, material, testing, vaccine, and they need support from the international community. All of this also gets into securing, let's say, some peace internal to the countries. You might understand that when you have a population that has already some problem to access proteins and food, if you have a disease getting into the country, it can lead to social problems, manifestation, war, internal war. So it's also a way of keeping the peace process. At the international level, we have something called GLUES, the Global Early Warning System. This platform is quite interesting because you have WHO and OIE, the International Organization for Animal Health, working all together in bringing information from the field on event, disease, rumors of disease, because usually you don't always have for certain the knowledge of what's happening in the country. You might have just rumors for newspaper. And the three organizations together analyze the data, look into the risk for the country of further spreading, and can decide to respond or not. I don't know why you have this one. I thought I had taken it out. Okay. That was just a slide saying that most of the information mostly comes from rumors in countries before you get validation from laboratory. And at times those rumors are really important to get as soon as possible to have a timely response in countries. In FAO, you have also the ECTAD, Emergency Control Transboundary Animal Disease, which is a unit that is responsible for responding to animal health emergency in the world, but also to implement long-term programs. It was created during the avian influenza crisis, but now it's covering lots of many diseases. That's the offices in the world. You can see that you have quite lots of countries covered by those offices, regional or national. And that's the world coverage. Okay? So basically those offices have the responsibility to react when you have a crisis. At the Rome level, linked with ECTAD, you have basically the firefighters, let's say. Not really, but almost. Okay? This unit is basically made to send experts on the field to guide countries to control disease. When you have an outbreak of avian influenza, you don't have enough veterinarians on the field, you don't have funds, you don't know what to do. Where do I have to do surveillance? How can I control the disease? Do I have to kill the animals? Lots of these questions often not answered in some countries. So they ask the EMC. Now, before it was the Crisis Management Center, now it's the Emergency Management Center. Develop missions with experts. They go on the field, they assess the situation, they assess the control measures, and they assist the veterinary services to control disease. First created for avian influenza, and now it's covering other transmitted transborder animal disease such as Rift Valley fever, foot and mouth disease, and others. The activities of the centers basically mainly on emergency, but also on preparedness, because when a country is well prepared, is able to start answering by itself, start responding to emergency by itself, before going to the international partners for support. So basically we have provision of mission, emergency missions, but also training in preparedness in response in many countries through the good emergency management practice document that was done by FAO. This is a broad overview, I don't think really up to date, but that's to give you an idea of where the coverage of the missions are taking place, mainly in Middle East and in Africa for emergency missions, a bit less in Asia, because we have a regional office that is really, let's say, covering those emergencies. But at the international level for EMC, it's mainly Africa and Middle East. And you can see the range of disease. You have African swine fever, anthrax, foot and mouth, avian influenza, Rift Valley fever, zoonotic and non-zoonotic diseases. So from emergency support to program and capacity development. Okay, this is basically that's what I've seen during my career. I studied in the emergency, now I'm more in program and capacity development. The Office of West Bank and Gaza has a role in terms of supporting the occupied territory on many aspects in development. I'm mostly in charge of the sanitary and phytosanitary program, which basically has the aim of increase the capacity on plant health, food safety, and animal health in Palestine. It's to increase the capacity of West Bank and Gaza to access trade markets, to sell products outside, to have products getting inside of Israel through East Jerusalem, so make sure that the standards are valid with international standards, but also to protect the health of the Palestinian people. Because you can imagine that pesticide in the food, disease in the food, use of antibiotics, so antibiotics residues will have a bad impact in terms of health for this population. So this is one of the main goal of the program, is to make sure that people don't get exposed to pesticide or to disease or antibiotics. Just for your information, an historic step was met last year. We finally got a food safety strategy where basically the ministry recognized the importance of protecting the Palestinian people on the food safety issues. It was needed because Palestine didn't have a clear legislation body. You had legislation that was coming from the Jordanian occupation, the English occupation. So all of this legislation was scattered. It could not be used in terms of a strategy, and also lots of different ministries. I'm going to go fast. A lack of public awareness, people not being aware of the importance of having a food safety inside the country, and lack of knowledge from the ministries, inside the ministries, but also the private sector, and capacities in terms of testing for the laboratories. So you basically have to look from A to Z to make sure that things are going the right way for the food safety. So the food safety strategy really helped. Another importance of the SPS program is to make people working together. So working together within Palestine, which is important, between the ministries, where you have different responsibilities, some ministries blocking the efforts, and you have a One Health approach now of the ministries, so that was really important. But a peace effort in terms of having around the table on technical issues, animal health issues, food safety issues, Israeli and Palestinian together to find ways of controlling and preventing disease. So it's also part of the work, and the technical level always work well. I'm not going to talk about the political level. So biodiversity and disease transmission, for me it's quite not a field where I work. I work mainly on disease control and prevention, and then implementation of these into capacity building for countries. For me was what do I think of when I think about diversity and disease transmission. So I had an example in Mauritania when we had a mission on Rift Valley fever. You could see that the biodiversity of the vector population was increasing basically and making things happen the wrong way. You had first Aedes being infected, then all of the other species of mosquitoes, culex, etc. That was basically making things worse, like making the disease explode, increase of cases in animals not seen, and increase cases and death in human population. So in this case, the biodiversity of the vectors, and that's, remember, you have vector, host, and environment. The biodiversity of the vector was something that would impact really badly the disease transmission, increasing the speed of infection and exposure of human population, and having adverse effects in terms of health and death of lots of people. We had co-infection of malaria, so people dying of malaria and Rift Valley fever, and that was really bad. And that's what was the cause also in the desert of Mauritania. We had lots of rain that would allow the mosquito population to explode. But then it's not all, because in animal production, we all know that biodiversity can be really useful in terms of protection for local pathogens. Local breeds usually are known to have biodiversity genetic background, let's say, that allow them against the local transmission, the expression of symptoms from local pathogens. So thinking a bit about the issue, I was like, okay, wait a minute. Trypanosomiasis this in Africa with local breed can be something that is not as bad as when you import animals from Europe, for example. Okay. This is also good in terms, this biodiversity, this genetic biodiversity, we're not talking about the vector biodiversity anymore, but genetic biodiversity of productions animal can be also interesting because it might decrease the transmission rate of pathogens. So it might decrease the excretion of the pathogens. And we can see in some example that the low biodiversity caused by extensive production systems can increase and facilitate the establishments of new pathogens. That was the case in Australia, New Zealand, with the arrival of the Nipah virus that was transmitted from the bats to the pigs, extensive production of pigs in an area where you have a low biodiversity, genetic biodiversity of animal production. It exploded, and we saw basically the establishment of this new pathogen in production systems with the risk to human health. Okay. Some other information and documents talk about the impact of hosts and the biodiversity of hosts in terms of disease transmission. When you have lots of hosts, those hosts might not have the same competency regarding a pathogen. So for example, for West Nile virus, we have lots of wild birds. There are primary reservoirs and amplification hosts, but they don't have the same competency in terms of production of the virus, of getting sick and extracting the virus. When you decrease the biodiversity of this, and you have also, a deletion effect. If you have different species, then the probability of contact and exposure from this species to the vector might decrease. Okay, the vector will have diverse species to go to, so you have a decreased probability of infection of this vector and decreased also probability of pathogen circulation. And you can understand that if you have something happening to those wild birds, depletion of population, and we heard before that's what's happening in many parts of the world where you have a decreased number of birds or bird diversity, then you might have an increased cases of West Nile. So increased number of mosquito infected, and then you might have increased number of human and horses infected. Lyme disease also has the same pattern where you have different hosts that can carry the tick that will get, that is trying to feed on animals, the white-footed mice that infect large number of ticks, other hosts that have a protected effect. They can feed the ticks, but they are not efficient in terms of disease transmission. Therefore, you see that the biodiversity will have a buffer, yes. So buffer effect, thanks. Buffer effect in terms of disease transmission. And what is interesting in this case for Lyme disease is that the species that excrete, multiply the most and feed the most the ticks regarding to Lyme disease is the one that is abundant in species poor community. So that's the one that's going to remain at the end of the day when all of the other species are going away. So you see that the disease is going to basically expose, and you have increased chances of exposure of different mammals and humans included. Another biodiversity loss is the biodiversity of forests, of plant coverage. So forest fragmentation, I'm not going to go into the effect of losing plant species in terms of protection against some plant disease. Some of them are quite similar to the one that we see for animals, and at times having a multi-species culture can prevent the arrival of the bad impact of some disease. Forest fragmentation is also a loss of biodiversity, and this loss of biodiversity will tend to increase contact of the human population with the wild species, so increase contact of exposure to known or unknown pathogens, and increase risk of known or unknown zoonotic diseases. I put the little Ebola virus in the bottom because I think that's something we have to look into, the emergence of new virus from areas where humans are not going too often. And when we're going to try get there more and more often, we might see things happen in terms of exposure to virus and virus adaptation to a new host that might have the ability to multiply and spread it quite fast. So a quick conclusion, it said that biodiversity loss tends to increase pathogen transmission in these incidents. That's what he said. I would make you look into the wording that is used. Tends, okay? It's not always true. It depends on where you look. If you look into the biodiversity of your vector, increased biodiversity of vector might increase the circulation of pathogens, as we saw for the Rift Valley fever. There's a lot of unknown factors that can influence this difficult interaction between wildlife and pathogens, so I think there's a lot of things to be said. And I present to you some case-to-case, because I think it's more, you have to look into the case to understand better how the biodiversity loss is going to impact the disease transmission. Thank you very much for your attention.